ICPR and organizing team, Department of Education, Department of Philosophy, University of Delhi. I welcome you all to the evening session of day one for the International Conference on Philosophical Counselling. Thank you so much for joining us. I first of all would like to thank all the participants for their enthusiastic participation. Since morning, we have so many participants who are making this conference what it should be. Thank you so much, everyone. I suppose this session can be called as where the East meets the West, as our speakers and the chair are all residing in America right now. So good morning to our speakers and the chair. Thank you so much for joining us at this early hour, especially Dr. Regina. I think it's 5 a.m. for her, and for others, it's almost 7 a.m. But thank you so much. So I would like to introduce the chairperson for this session, Professor Regina Ulliana, who is a licensed clinical psychologist, a certified philosophical counselor, a certified philosophical midwife in California, USA. Dr. Ulliana provides workshops, consultations, training, and dream study in philosophical midwifery. She also works on the adaptation of Socratic dialectic to bringing forth false belief about ourselves as for our reflection and understanding that have already repetitively blocked us from achieving our most personally meaningful goals, and especially the highest philosophical and spiritual quest to know thyself. Dr. Ulliana is also the co-author with Dr. Pierre Grimes, who is primary and principal author of Philosophical Midwifery. I now invite Professor Regina to please come forth and say some words before proceeding for the conference. Thank you.
Thank you. And I'm not professor, I am a psychologist, and I stopped teaching many years ago. So I am a practicing psychologist as well as a practicing philosophical midwife. So I want to thank Professor Bala and all the other conference organizers who have made it possible to continue the discussion, which started many years ago on the idea of philosophy as a philosophical practice. I want to say that because I was asked to be a chair, and so please, it was recent, like 2 days ago. So I don't often chair, I often present. So please guide me if you find the need to. But let me go back and again thank Professor Bala and his great organization. But now the presentations are being formally introduced through this conference at the first International Philosophical Conference sponsored in India. This is another milestone that provides the opportunity for philosophical counselors, practitioners to share their ideas and experiences, and to continue to raise questions for discussion and dialogue, and to support one another on the journey into this fascinating topic called philosophical counseling. That's my introduction. I was given a little, I didn't realize I had put that much in the introduction when I sent it to you, but I will repeat some of it. I will begin with myself. Professionally, I am a clinical psychologist, a certified philosophical counselor, and a philosophical midwife. I presently do workshops and consults and train and do dream studies in philosophical midwifery. Now, I put philosophical midwifery at the end, but it should be at the beginning. And just to give you a little more of my history as to why I'm a psychologist and also a philosophical counselor. I am a philosophical, my choice to go into psychology was not because of psychology, but because of my introduction of philosophical midwifery after meeting with Dr. Pierre Grimes. I knew immediately there was something very meaningful about philosophical midwifery, although at the time my ignorance of how it stood in the scope of philosophy and psychology was limited. I first got my BA in philosophy thinking that was an avenue. But at the time, academic philosophy was not personally or spiritually meaningful to me. I thought that psychology could be an avenue to present philosophical midwifery. But over the years, I found there was a great difference between the goals of philosophical midwifery and psychology. But I was a psychologist. So I turned to taking the method of philosophical midwifery and apply it to those patients I worked with. It was obvious it had its benefits, but I couldn't use the method of philosophical midwifery purely. So I adapted it and I called it Grimes dialectical rational psychotherapy. I held the principle that there was no interpretations, but a use of an adapted Socratic dialectic to the problems of recidivism and youth prisons and patients with severe mental illness in psychiatric hospitals. I have published articles and presented at conferences on this purely rational cognitive approach. However, philosophical midwifery was not something psychology could embrace, for it would mean it would need to challenge the premise of interpretation, which dominated most of therapeutic treatments. Psychotherapy bases itself on the medical model, which assumes interpretation from gathering information from patients, leading to a diagnosis and then a prescription of treatment. In this model, the person is a passive recipient to the diagnosis. When philosophical counseling emerged, it brought the possibility of bringing home philosophical midwifery under its proper domain, philosophy, and not psychology, and provided a road to include the active participation of the person in their journey to understand their sufferings in their own terms, rather than through interpretations. Thus, individuals could understand their personal problems outside the medical model. It is here that philosophical counseling and philosophical midwifery can bring persons to discover meaning, value, purpose, and the significance of their own minds that provide the elements toward a destiny rather than a fated life, where a dialogue becomes the staple of discussion and the avenue of friendship. I co-authored with its primary and principal author, Dr. Pierre Grimes, titled Philosophical Midwifery, a New Paradigm for Understanding Human Problems. I think it's a fundamental and valuable piece of work. In this work, I functioned as a research psychologist, which was part of my training. Dr. Grimes and I decided to collaborate on validating philosophical midwifery's methodology, and also to challenge the pervasive belief at the time that a purely rational method cannot be validated, nor can it raise emotionalized behaviors. And just for your information, many of you know Albert Ellis, and his first book was called Rational Psychotherapy, but he changed it to Rational Emotive Psychotherapy because of the pressures of the psychological community that a rational approach could not emotionalize behavior. So that was the reason for why he changed it to RET. But in our research, using Dr. Grimes and my own knowledge of research, we developed an original study. And from the results, we concluded that the long-standing belief held in psychology that a rational, purely cognitive method, in principle, is incapable of raising significant levels of emotionalized behavior and the methodology being empirically verified was rejected. So I wanted to say that because I wanted to compliment Dr. Grimes. Now, my job here is to introduce 3 world-renowned speakers that have taken the journey to explore, raise questions, present experiences, and apply their academic knowledge to the agora, the marketplace. That is, they have taken their academic knowledge to raise the level of meaning, well-being, value, and spiritual possibilities to the public through this fascinating topic and its challenges called philosophical counseling. Our first speaker Dr. Lydia Amir, is professor of philosophy at Tufts University in Boston, USA. Sorry. She is president of the Israeli Society for Philosophical Practice. She is co-director of American Philosophical Practitioners Association. She is the founding editor of Lexicon series in philosophical practice. She is president of the Israeli Association of Philosophical Practice. She is author of 2 books on philosophical practice and co-editor of 2 anthologies. She has lectured and discussed on such topics as philosophy of humor, friendship, Aristotle, and philosophical counseling. Today, Dr. Amir's presentation is titled Philosophical Practice as Meta-Philosophy. Welcome, Dr. Amir.
Thank you very much, Regina. Just a quick question about the time. Am I still supposed to finish with the discussion before 7:30 Indian time? Can someone answer me?
Ma'am, you have total 30 minutes in which 20. Can you hear me?
Yes.
Ma'am, there are total, you would have 20 minutes for presentation, and following that, there would be 10 minutes for question and answers.
Okay. Thank you so much for inviting me for this conference to be a speaker. I'm very sorry I cannot be there in person, and I'm very sorry that due to the time differences, I won't be able to attend much of the conference. I'm really sorry about that. I am now in Washington. This evening I will be in Boston. And so I'll be present as much as I can, but I wish that someday I might be present in India for a similar conference. And I hope that this conference is the first of many more to come, and that the inauguration, maybe the formal inauguration of philosophical practice in India that this conference represents would be just the beginning of many fruitful years and fruitful cooperation, as already I have had with Professor Bala and other philosophical practitioners in India. I was contacted before Professor Bala by another association that turned to be led by one of Professor Bala's students. So, contrary to my habit, I won't speak the whole time because I think this is a very festive occasion. So I prepared something in writing, and then I'll talk. So I wanted to explain why I see philosophical practice as metaphilosophy. That means as a field that has a theoretical importance in philosophy itself, and also to share some of the advice that I may find necessary or interesting, or I don't know, something I could build on based on other countries which have begun to use philosophical practice. So what should you do when you want to introduce such a field to a country? All right. So again, I'm very grateful for the invitation to say a few words in this conference, which I take to be an official celebration, if not an inauguration, of philosophical practice in India. I would like to share with you some thoughts about what setting a practice of philosophy in a country involves, which fields need to be addressed, and how this endeavor is not only practical, but intellectual. And I argue that it ultimately requires a meta-philosophical inquiry into the nature of philosophy itself. So first, to set a practice of philosophy involves verifying how philosophy fares in the country in relation to religion, to the mental health practices and to health practices in general, and to education in the various settings in which philosophy is taught. If not in high school, then at the academic level of the university. All three studies, religion, mental health, professions, and education, require an interrogation of what philosophy is, what it can be, and what it should be. That is a metaphysical inquiry into the nature of philosophy. Second, this inquiry should be inspired by the past, especially in India, nourished by present needs and oriented toward the future. It should reveal the themes and topics which are not only recognized naturally as philosophic, but which also benefit the community in which we live in ways that neither religion nor the mental health professions, nor indeed the general education can work without effort. It will easily be seen then that the role of philosophy has always been set as an alternative to established religion. If you study the role of philosophy, at least in Western philosophy, an alternative view of the well-being society recognizes through the contemporary endorsements of the mental health professions. That means that philosophy has always provided an alternative to what society has considered as the main means to well-being, and then as an educational tool that supersedes other fields in education. Of course, if philosophy would be the same as the education given in any country, then there's no need of that. So this is an educational tool that supersedes other fields in education or that cooperates with them. Usually it has been much more ambition, as if it was topping the other ways of education. If the practice of philosophy sticks to these traditional goals of philosophy and adapts them to contemporary needs of one society and future objectives of society and of philosophy in that society. Third, it will not only need to fight for a place, but will always be of need, if not for the many, then for the few. Let me say why I'm emphasizing that. I don't know how it is in India. I don't know exactly how it is in the United States, but from the country I come from, there's a very strong union of psychologists and social workers and psychiatrists, etc. So I found that the best way for me was to cooperate with them and not try to propose an alternative to them, but find themes, topics, and subjects that philosophy can provide and clarifying view on them that psychologists and other health professionals cannot. So that philosophy and philosophical practice should not fight for their role within society, but just show that the role exists, has always existed, and actually instead of inventing needs, showing that the needs already exist, and that philosophy traditionally, and by its very definition, can help address those needs. Indeed, this kind of practice won't be different from the perfectionist tradition in philosophy that is being revived today and is variously referred as philosophy as a way of life. So if you will go for a philosophical practice that doesn't fight for its role, but sticks to the traditional goals and adapts them to contemporary needs and future objectives, so it won't be different from what we may call the perfectionist tradition in philosophy. That means a tradition that tries to perfect the individual according to various ideals. For example, in ancient Greece, it was eudaimonia. Then in Hellenistic time, it was ataraxia. Eudaimonia meaning flourishing, ataraxia meaning peace of mind. In the Middle Ages, it was salvation. It was the idea that Christianity offered. In early modern philosophy, it was redemption here and now. It was a philosophic redemption for the individual as championed for by Spinoza and followed by others. Then in the Enlightenment, there was a twist on that, that it was a kind of redemption here and now, but through social cooperative action. Then you can talk about the idea of the romantic period, which is self-realization, and then the existential philosophies added the last philosophical idea that we know of, authenticity. So together, these ideas form what I would call the perfectionist tradition in philosophy, whose objective is to perfect the individual, not to make him or her completely perfect, but to advance toward a certain view of what would be a perfected human beings. And we have various examples of that in the history of philosophy. So we can revive this tradition, and it's actually being revived today if you look at books that are being published, and it's referred to as philosophy as a way of life. If, however, philosophical practice has the ambition to address the many four, it would have to reconsider its thesis, its means, its settings and rhymes to suit the needs and the capacity of the many. So there is a difference between addressing the many or developing tools and objectives that are suited to the many. For example, in Hellenistic times, all these schools that continued later into Roman times, the Hellenistic schools, Stoicism, Epicureanism, and skepticism, addressed the many, but they were very perfectionist. Their ideas were very, very high and very difficult to follow by those who were interested in that. So what I'm talking now, it's about reconsidering all of these, the theses, the means, the setting, and the rhymes, the rhythms, yes, not the rhymes, the rhythms, to suit the needs and the capacity of the many. Because if we want to address the many and make it efficient, not only to show that there is an idea in philosophy that they cannot follow. So we have to reconsider all that. Ultimately, the practice of philosophy, when brought to the community or to the department of philosophy, for me, it's the same, because the community comes to your university to study. So the practice of philosophy addresses the many and necessarily involves a metaphilosophical inquiry into what this would mean. Does philosophy need to be changed to address the many? If yes, in which ways? In conclusion, it is such a metaphilosophical inquiry into philosophy's past, present, and future, which I invite you to undertake, and which I propose to begin doing here with you. This can be done, however, only after the perfectionist role of philosophy as offering an alternative to established religion, to the societally oriented mental health professions, and to the general education is first addressed and then assessed as relevant or not to your great country's past, present, and future. So what I would like to do is to invite you to do your own metaphilosophical work, and only to finish my talk to share with you the metaphilosophical work that I have done in that book called Taking Philosophy Seriously, Overthinking Philosopher's Responsibility. Of course, you don't have to endorse that, but it can be just an example of the kind of work that one can possibly do. In my case, I do not consider the work in the classroom and the work in the community as being completely different. I consider them to be on a continuum in which, being a good teacher, you want to bring philosophy to your students in class in a way that would engage them, as Regina has said, spiritually, psychologically, existentially, maybe, so that you teach as if it matters. And this is actually to be a good teacher. And in order to do that, you have to understand the theory so well that you can embody it for the students. And that means that in philosophy, there is no difference between theory and practice, because to understand well the theory, you have to embody it and to live while practicing it. So you cannot just theoretically explain a theory and hope that it will be understood. It won't be understood. So it has to be presented in a way that is practical for the students. If you cannot give an example about Kant's ethics, and show how you would use it in everyday life, and ask the students to refer to that with their own lives, they would never understand Kant's ethics or any other ethics or any topic or any general philosophy. You have to be able to look at the words through Stoic or, I don't know, Schopenhauer eyes for a while in order for your students in the classroom to understand what you're telling them. So to be a good teacher in the academy means to practice philosophy, at least during the time that you teach it. And if you do it only on spot, it won't work. You have actually to practice it outside of the classroom. Then these students that are coming to the department usually study something else at the same time. They are part of our communities. They are not, I don't know, people that were taken as prisoners of philosophy and would go with it wherever it will take them. Absolutely not. They would leave if it's too theoretical, too abstract, not interesting enough, or if the teacher is not inspiring in some way, or they cannot understand because it's only theoretical. So it's the community that's coming to the philosophical department. So if we want to have a future for philosophy in the academy, and it's not at all obvious that there will be a future, philosophical practice has to be brought back to the universities. It's only as philosophical practitioners of philosophy that philosophical teachers can survive, and stay in the academy and make sure that everybody that goes there to get some education hears about philosophy and what it is and what it can be, maybe to continue this education, as we say, in the community, with the philosophical practitioner. So if you are a teacher and you have assistants, the assistant should do practical work with the students. Go to the field, go to the city, go to their lives, and think how the philosophical theories can be implemented in their own lives. And the exam should be about that, and not only about the theory. Maybe one question about the theory, and then the second that forces them not only to the reading, but to implementing it in their lives and to see what they think about that. Is it viable for them? If yes, why? Yes, why not? Is it a desirable theory? Why yes, and why not, from their own experience? All right. So when you go into the community, what are you doing when you are meeting people? Do we want to counsel them? Do we want to provide therapy? The last idea that I didn't mention is actually not a philosophical idea. The last idea in the West is called therapy. It's a psychological idea, and it has usually superseded the other ideas. We are not aware, in the West at least, that there are philosophical ideals that are worth striving for. We go for the general well-being. We use the word happy, for being just joyful for a moment. We cannot even think that we can strive for a sustained happiness that we may call flourishing or ataraxia or redemption here and now. That philosophy is very, very ambitious. But when we go to the community, what we are doing when we are addressing people, we are actually being a good teacher of philosophy. And what does a good teacher of philosophy do? Well, he adapts the themes, the topics to the interests and the capacities and the needs of those in front of him. So if it's in the academy, it's something else. It depends also if it's philosophy students or other kinds of students. Sometimes students come from engineering or other disciplines to philosophy to have one course. And when you go into the community, you adapt whatever you teach, whatever you share, whatever you know. As a philosopher, you adapt it to those in front of you. You don't want to make, a parade of your power and knowledge. Absolutely not. So you adapt first to the needs and to the interest, because otherwise you are not to be heard, of course. So this is to be a good teacher. And you adapt to the capacities to the previous knowledge, to the capacities of understanding, not only in general, but at this very specific moment when you see that's for some reason, whatever you say doesn't go inside, you don't push it further. This would be, I think, your cue that you are pushing too far as a teacher, even in the community, if there is what psychologists would call resistance. So you don't continue pushing there. That means that you are overdoing your job in some way. So to be a good teacher of philosophy is actually to embody it, to practice it, to practice pluralistic views, sometimes this, sometimes that, so that you understand it well, and you can share your knowledge with people either in the university or outside of it. And I consider the philosophical practitioner as a good teacher, sharer of philosophy, through dialogues, through examples, through readings, to whatever means you have to invent actually to reach to people outside of the academe. And believe it or not, in the academe today, you cannot just give a talk of 1 hour and a half. Even at Vienna University, I was shocked to know they can concentrate only in the philosophy department for 20 minutes, no more. Then you have to think of other modes of teaching or sharing or partaking of what you know. So why is it important to partake in what you know? Because people come to see us as philosophical practitioners. So they may come to see me as Lydia. This may be very interesting, but professionally, it's not right that I just use my own personality to talk with them, that I happen to read Freud or I don't know, some kind of poetry. They come to see me as a philosopher. So, of course, it's normal that I use whatever knowledge I gain in philosophy and share this with them. Then there is no problem of the legitimacy of the discipline, because I am engaged as a philosophical teacher, a private one, a tutor. This is what for me philosophical practice means, a tutoring of the people who come to see me. All right. So this is to say that philosophical practice and the philosophy in the academe are for me on a spectrum, are related, they are not fundamentally different. So it's a continuum between them, or at least it should be if you bring back those of us who teach in the academe, philosophical practice, knowledge and know-how and how can I say, non-mediated encounters to the academe as well. Now, when I thought about how could we develop a philosophy for the many, I thought that the term that I would use would be meliorism. Yes, meliorism, in contradistinction to perfectionism. But I thought that philosophical practice should be faithful to philosophical objectives. It shouldn't be completely different, otherwise it won't be philosophy anymore. So because I don't have much time, let me say that I have chosen to stick to some ideas that I think are mainstream philosophy. Philosophers strive for the truth, between truth and happiness. They prefer truth. They hope that truth will be happy, but if not, they go for the truth. Philosophy offers some kind of liberation, even if it's a negative way of liberation from misconceived idea, preconceptions, narrow thinking, narrow feeling as well. And we strive for wisdom. Yes, philosophy is the love of wisdom. So truth, liberation, and wisdom are philosophic notions. And the methods is still to be philosophical, adequate reflection. This is our forte, the reflection. Using abstract thought, I will tell you in which way, not only abstract thought, maybe a movement from the concrete to the abstract and back, but not giving up on abstract thought, which is therapeutic in itself. Logic and epistemology. So the epistemology, I think, would best work for philosophical practice would be virtue epistemology, not an epistemology that says this statement is true or not true, but an epistemology that wants to develop in you intellectual virtues. This is what philosophy actually does for you. And because, as Bertrand Russell has said, The objective of philosophy is not, and of wisdom is not only developing wide thought, but also wide feelings. So virtue epistemology is the best epistemology for philosophical practice, because an intellectual virtue may be also a moral virtue. For example, for Spinoza, understanding is the highest intellectual as well as moral virtue. So we want to use abstract thought in practice. We begin from the concrete stories. We bring you to the abstract level of extracting the notion or the concept so that the person feels at ease and embraced by the human condition and sees that this question has been asked in philosophy. And there are many answers to this question. So this reduces the stress of just the dialogue and what you think and who you are, etc., which is a little bit too focused immediately on the individual. We take the individual to the abstract, to the many, to the philosophers of the past and the present, and think together, and then go back to the concrete once an answer has been found, and we try for some time in real life, in everyday's actions, and this is back to the concrete, and we follow it in the behavior. So we want to foster intellectual virtues. This is our forte in philosophy. No other discipline does that. We foster intellectual virtues. And finally, we want to enhance encompassing feelings through moral virtues that accompanies intellectual virtues. So we want also encompassing feeling. For example, if you understand more, you have the capacity of having a pluralistic view, yes, of things. If you don't understand the other points of view, you cannot have that. These are empty words. So hopefully through these three means, which is bringing abstract thought into practice, fostering intellectual virtues, and enhancing encompassing feelings, we want to enhance the autonomy of the individual, which is something that philosophy does, which is a forte of philosophy. And to those who aspire to be more autonomous, and believe it or not, this is what we need to do in democratic countries in which somehow we have the liberty to think, but we don't have sometimes the means to that. So this is what we should do as philosophical practitioners. We should help create autonomous agents that know how to think better about all cases that they would encounter, and create in this way, and this is an educational goal, process that is of the greatest value, create the citizens of the democracies in which we live. Something is missing when we are told that we can be autonomous. Of course, we are all autonomous, but to be philosophically capable of thinking and feeling better, and that extra length of education that philosophy gives is what is needed to actively use our capacities as citizens in democratic societies. So call it an educational role, a political role, philosophical practice as a vital role to play in each society, if only it would engage in metaphilosophical thinking and rethink what it is to bring philosophy to the man. Thank you very much.
Thank you, Dr. Amir.
Thank you.
Any questions? Any questions? Please don't hesitate. Some nice information. What question would you like to set? Go ahead.
I want to really thank the presenter for making us to understand the role of mental thinking in philosophical counseling. And I also loved the way she brought about the idea of moving from concrete to the abstract and back to the concrete in order to elucidate what philosophical counseling is about. I want to know whether that is in relation to what Immanuel Kant was saying regarding the power of transcendence. Because Kant sees transcendence as the seat of innovation and development. So is she suggesting, would you like to look at transcendence as also a method of philosophical counseling? That is my question.
I hope you got that, Dr. Amir.
Yes, yes. I would address transcendence in a moment. I just want to say that all I said is that in order to understand what philosophical practice can be in a country, and we have seen in many conferences in the past that it's different, for example, in South Africa and Denmark, you know, so it's different according to different countries. In Norway, I know that Guru is here. So we need to engage and inform of thought that rethinks what philosophy is. It's not only what philosophical practice is, it's what philosophy is, okay? Because I don't see a very defined frontier between the community and the academe, so I cannot find a very defined border between philosophical practice and academic philosophy. So this is ideally, it should go both ways. So we should engage in thinking about what philosophy is, which I call metaphilosophy. And actually, just to say that today in the world, you can see that also analytic philosophy has begun rethinking what it is and what philosophy is and what it should be, in a way, because they want to survive. So that was that part. The part about from the concrete to the abstract and back, let me just say, I can share with you online, you know, that book, Taking Philosophy Seriously. It was published in 2018, and it has chapters about all the things I talked about, also about the intellectual virtues, and maybe intellectual virtues is more developed in Rethinking Philosopher Responsibility in 2017, the same publisher. I can share with you both books so it will be clearer. So that was the former part of your question. Now, what do you mean about transcendence, so that I can answer you more clearly, please, if you can explain.
Thank you. I said transcendence, I looked at it from the perspective of Immanuel Kant.
Okay.
Because he sees transcendence as the seat of development, the ability to move from the known to the unknown, and also to come back to the known. Oh. And that is exactly what I thought you were talking about by moving from the concrete to the abstract and coming back to the concrete in order to explain, or in order to showcase what philosophical counseling is about. So okay. I'm now asking you whether you are seeing transcendence as a theory of philosophical counseling.
I understand. Thank you very much for clarifying that. When I meant the movement from the concrete to the abstract, by the abstract, I mean, for example, the notion of friendship or love, knowledge. You know, you quarrel with a friend, so this is the concrete. Now, a philosophical practitioner may choose the notion of friendship and bring it to the abstract by asking the general question: what is friendship? Okay, and then showing the preconception of the question, and then maybe formulating one answer through your own view of it, through some kind of Socratic means, then another answer, which may be the friend you quarrel with, his own view, you know, and then maybe a third one that the philosophical practitioner would formulate, or you would read in Aristotle or Cicero or Montaigne. You know, then you have various answers of the question, what is friendship? And then you exemplify that actually it's a question that runs throughout the history of philosophy, that the Greeks had it, and the Renaissance philosopher Montaigne questioned it, and many others. So instead of saying, oh, this is part of the human condition, not to know what friendship is and actually quarrel with friends because people have various views of what friendship is and they never articulate it, you just exemplify that. You show that this is the way the mind opens You don't say you need to be pluralistic, you need to understand your friend. These are words. By showing these different answers, you actually open the mind, your own, and the mind of the other person. And this is the education. You don't say, I'm going to educate you. This is actually the process itself. And because you do it in a transparent way, this is an educational process that makes the other person autonomous, because he or she receives the tools to do it later on their own without your help. Now, when you talk about transcendence in Kant, I wouldn't say that transcendence is necessarily abstract. For more people, transcendence is something very personal, maybe a personal God, and absolutely not abstract. But the movement you're talking about, from the concrete to the transcendent or the unknown, as you say, and back, is interesting. It can be a movement from what we know, the way we live, and a movement towards what we don't know. You know, a skeptical movement that will be deeply educating, nourishing. So we move, for example, we talk about justice. You feel that you've been injured or wronged by something. And we may, when asked what is justice, and you know, reach one of the answers, karma, that it may be a law of a moral rule that would make things right, although you cannot see it sometimes in a lifetime. So I feel, as a skeptical philosophical practitioner, maybe also the West, I can say that we may not know if this is true or not. So we'll go from the concrete and into the transcendent in a way that the unknown, you know, we can discuss what we know and don't know about the unknown, what can be rational to assume about it. Is reason the right tool to address that? But that movement may be interesting, from the known to the unknown and back. So thank you for this question, and I hope I answered it somewhat.
Brilliantly well, thank you.
Thank you.
Yes, Professor Andre, please.
Hello, Lydia and everyone. Always a pleasure. Lydia, I must say, you express yourself with such clarity. I love that. Among the different interesting and relevant points that you mentioned, one called my attention in particular, which is this idea that in philosophy, there is no difference between theory and practice. And I get the point, right? If you don't embody it, you don't really comprehend whatever it is that you are dealing with. I totally see and agree with that. At the same time, I don't think it's obvious how to actually promote the process in philosophical counseling of the client, the seeker, actually bringing whatever it is that we are working during the process of philosophical counseling to the real practice of their lives. I don't think the mechanism of promoting that is an obvious one. So if you have any comments on how to do that to enlighten us, I would appreciate it very much.
Thank you so much for your question. It's very important. This is why I assume that before you promote it, you need to do a metaphilosophical work, because then you are promoting philosophy itself. And it's easy. If you believe in philosophy, once you were described it, you know, to answer those needs of which I'm talking, and those needs that do not take the place of other disciplines, you don't have to say that the rest are worthless. All you have to do is to say you need philosophy in your life. You need, and maybe in some countries it's not good to use the word philosophy. So you can have, I don't know, sessions, group sessions, lectures about what is justice, what is friendship, what is love, what's the role of sexuality in life, yes, what is knowledge. So the way I work, I go for questions that I know that no other discipline has an answer, and that I can provide many answers to the question. So I have something to give. So I don't feel powerless when I have to promote something. You know, I believe in the product. which is not me, not the philosophical practice, but philosophy itself. It only needs to have some explaining in the society. So you have first to discover the most meaningful, important notion, junctures in which philosophy can actually help. In COVID times, it would be how to think clearly in a pandemic. What is trust? What is a scientific method? What is evidence? You know, so in each period, in each time, not only for every person, you find as a philosopher naturally the notion or the problem or the concept that you problematize as a philosopher. And this is what you advance. It's more easy to do it first in small groups or give a lecture about that. And at the end of the lecture, say to the people who come to talk to you, you know, we can continue this conversation in private. Here's my card. Okay. So this is the thing. You promote a way of addressing philosophy or some problematics in a way that people never heard of. Practical, hands-on, interesting, relevant. All right. So in the practice, what I do is that you know, you can promote this. So what is justice in 4 meetings, you know, in whatever, you know, I have some kind of method or path which enables the client to be completely aware of what's going on, and then maybe can do it by himself or herself with other people later, you know. So for me, I think it's important that the process will be transparent. So if people would ask you, let's say I come to talk with you, what would happen? Then you say, we'll formulate a question, we'll present various answers, then we'll evaluate the pros and the cons of each answer. The answer we'll present will be East and West, will be from various epochs of philosophy. We evaluate them, you will choose one that you prefer, and we will go into a new question, either necessary, either related to the former one or not. So the person knows, okay, I'm here for 4 sessions, or maybe I leave after 1 answer. He knows what he has done. He has formulated a question. He saw the relationship between this and the problem, the concrete problem or interest that he had. And maybe he stayed for 1 answer, his own, maybe for 2 answers, and then he went away. All right. So he can continue on his own, or he can come back at any point, and you know where you are. So this is very important, you know, not to fake some kind of certainty or trust, but to show that there is a path. It can be this one, it can be another. You know, I've chosen this because one of the answers to the question, does philosophy advance, is through better questions. So sometimes you find a question with a person that it's not the best question. It begins with what is friendship. It can be then what's the value of money, because the quarrel can have been about money with a friend, you know. The value of money in the good life, and sometimes it's about other things. So
Dr. Amir,
we have to finish.
Dr. Amir, we're going to have to stop and move on to the next speaker. If anyone has questions or they wish to, just add them to the chat and they will be collected and provided to Dr. Amir. Thank you.
Thank you so much for your question.
Thank you very much for your insight, Lydia. Thank you.
Okay, the next speaker, please post your questions in the chat if you have any for Dr. Amir. Thank you. Fascinating. Becoming philosophy. Yes. Dr. Rick Repetti. He has an amazing background. He's our next speaker. He is a professor of philosophy at CUNY, Kingsborough in Brooklyn, New York. He is an APPA certified philosophical counselor. I'll list as much as I can. A certified cognitive behavioral CBT therapist, a certified mindfulness practitioner, and a certified life coach. with 2 years training in gestalt therapy. He is on the board of directors of the American Philosophical Practitioners Association, known as APPA, the editorial board of the Journal of Buddhist Ethics. I'm going to skip some. He was on the board of the former Journal of Science, Religion, and Culture, and was also chair and previously associate chair of the American Philosophical Association's Committee on Philosophy in two-year colleges. Now, presently, he is a fellow of the Center for Contemplative Mind in Society. Dr. Repetti is also, and this is something I find important, yoga and meditation practitioner since 1973 and an instructor in both since 2000. And he is also into martial arts, a 4th degree black belt in Shotokan Japanese karate. I won't list the several books that he has written, but he has in his biography listed several, and he's written many articles and chapters on Buddhism, meditation, and free will, philosophy of religion, and contemplative philosophical pedagogy. One of his books is Buddha's Perspective on Free Will, and another one is Buddha's Meditation and Free Will, a theory of mental freedom. So you can find where Dr. Repetti's mind is. In his presentation today, he is going to talk about what is a philosophical counselor? And you've heard some of the presentations. Is it a guru, a life coach, or a therapist? Welcome, Dr. Repetti. Thank you.
Can you hear me?
Now.
You can hear me now?
Can hear you now.
Okay, sorry about that. Before I begin, I'd like to say it's an honor to be invited to present here. I'd also like to thank Balaganapati, Charu, Madhulika, and the other organizers for putting this great conference together. And thank you, Regina, for chairing this plenary. Like Lydia, I would have preferred to be there in person, but it's good that this is remote because I contracted COVID just before the new year and I'm not 100% well yet. So please keep that in mind if any of this is unclear, especially in the question and answer period. Okay, before I begin, confession, this paper was inspired by, this presentation was inspired by a recent article I read reviewing and comparing psychology and philosophical counseling, which I thought was a little too critical, so it inclined me to do my own comparison. So let me begin. Philosophical counseling has roots in ancient philosophy, but it is distinct from academic philosophy. But it's a relatively new phenomenon. So many are unclear about how it compares with psychotherapy, life coaching, or following a guru. I'll compare all of these, examine some of their disparities in credentialing, the issues that direct individuals to contact the different types of practitioners, and their relative areas of expertise. I think most of these issues may be best addressed by philosophical counselors. Philosophical counselors differ from gurus, life coaches, and psychotherapists. The philosophical counselor is a bit of each, yet is distinct from each of them. All but gurus here might be seen as employing different forms of talk therapy, ways of verbally engaging with people to help them address their concerns. Gurus occasionally take on some of the same roles, but they're considered sages, so wise that their teachings are venerated by their followers as gospel truths. While the other practitioners sometimes involve individuals who have significant expertise and some wisdom, they are not thought to possess supreme wisdom like gurus. Prophets, sages, saints, yogis, meditation masters, and the like throughout human history have played the role of guru without being certified but by attaining exalted spiritual states or sometimes by feigning them. Life coaching is not regulated at all, but it can be as impactful as any of the modalities of practice I'm discussing here. Tony Robbins comes to mind as somebody who's had that kind of impact on people. The fact that they're not certified but play a role similar to guru is the main reason I bring up life coaches here, not the only one. By contrast, the credentialing of psychotherapists is used as the standard against which to criticize philosophical counseling as insufficiently regulated, sometimes. To be allowed to use the term psychotherapist in New York, for example, one must have either attained an MSW, a Master's in Social Work degree, or a PhD in clinical psychology. Both degrees require taking courses in psychology such as developmental psychology, abnormal psychology, and so on, where students learn the major theories of the leading figures in the field, Freud, Jung, Maslow, Piaget, and so on. That is book learning. To develop actual counseling skills, many, if not most, newly certified psychotherapists go on to do clinical training in postgraduate institutes before taking on clients, or as soon as they realize they don't know how to do it skillfully if they start a practice right away. This bears on the contrast between psychotherapists and philosophical counselors in ways that I'll say more about shortly. The bulk of my analysis is about comparing credentials and skills. Clients generally contact psychotherapists for assistance dealing with emotional, psychological, or interpersonal issues. Clients generally contact life coaches for assistance with career choice, educational plans, goal structuring, and general lifestyle advice. And clients generally contact philosophical counselors for existential, moral, religious, or spiritual issues, issues of meaning, purpose, doubt, faith, sense of self, values, to solve a dilemma, or to develop a philosophy, among other things. As for crossover issues, for example, an issue a life coach might be approached for, but which one psychotherapist might actually help with, I've been given life coaching type advice from my Gestalt psychotherapist, and I've given that as well as psychotherapeutic assistance to my licensed clinical psychologist client. That's because the lines of demarcation between these disciplines are fuzzy. And if a practitioner of any of these three approaches is a pragmatist, then they'll dispense whatever counsel might work in a given case. If one needs help with anxiety, for example, the most likely choice is a psychotherapist who can decide if medication is needed and thus may refer the client out to a psychiatrist. But what if the anxiety is based on career plan ambivalence? A life coach may be a better fit, since life coaches specialize in such matters. If a college student doesn't want to go into the family business, a philosophical counselor may be a better fit, since philosophy is all about resolving dilemmas and other conceptual problems. I think philosophical counselors are equally, if not more qualified to deal with the issues that roughly overlap among all the reasons clients seek assistance from the different types of practitioners for several reasons. First, the leading figures in psychology, for example, Freud, Jung, James, and so on, are a drop in the bucket of philosophies of mind and action that philosophers are expected to deeply understand. Philosophy also includes a deep concern with theories of human nature, the nature of the self, the mind-body-soul relation, the relation between the appetitive, emotive, and rational elements of the psyche, theories of motivation and of action, to mention just a few. Philosophy also includes related fields, each of which bears on the philosophy of mind, such as theories of meaning, language, value, ethics, metaethics, ethical cultivation, epistemology, metaphysics, logic, reasoning, and so on. As new fields emerge, new philosophies of them emerge, such as cognitive neuroscience, neurophenomenology, and experimental philosophy. Most of these fields constitute elements of cognitive science in the broader sense. So it's plausible to consider cognitive science a branch of philosophy, just as almost every other branch of science is an offshoot of philosophy that takes on a life of its own upon the accumulation of enough theoretical knowledge, methodology, and factual knowledge in a given domain, such as when psychology branched off the limb of philosophy of mind on the metaphorical tree of philosophical knowledge, when William James, psychologist, parapsychologist, and pragmatist philosopher, taught the first psychology courses, oversaw the first American dissertation in psychology, and helped establish the first psychology department at Harvard, without any credentials recognizable today in the field of psychology. Not to mention his great books, Principles of Psychology, which is a seminal text in that field, and Varieties of Religious Experience, right, which is kind of the same thing, but in the philosophy of religion and theology, as his Principles of Psychology is to the field of psychology. The point is, no credentials in psychology that would be recognized today. Philosophers are also expected to know the bulk of the world's major religious or spiritual philosophies: Hinduism, Buddhism, Jainism, Taoism, Christianity, Islam, and so on, all of which are ways of life and complete philosophical systems. Broadly construed, pastoral counseling within these systems is generally transmitted across generations through apprenticeships, analogous to the guru-disciple relationship, rather than through credentialing programs. Philosophers study these systems, but without the sort of ideological commitments that often bias practitioners within them, affording philosophers a more objective perspective on these knowledge frameworks. The Jain doctrine, Anekantavada, or non-one-sidedness view, holds that every cognitive agent has a valid perspectival angle on reality, and the sage is the one who knows as many of them as possible. This does not entail relativism, but rather the broadest and most informed understanding of reality, objective reality. Philosophers aspire to be Anekantavada experts, whether they have studied that doctrine by name or not. Philosophers with years of experience teaching undergraduates and graduates not only regularly encounter students from all of these philosophical traditions, but typically expose them to philosophical midwifery, Socratic inquiry, by cross-examining their beliefs, reasons, views, and values, frequently uncovering doubt and its handmaidens, curiosity, and a desire to understand. When any such philosophies come up in class, or even when non-religious philosophies come up in class, such as relativism, existentialism, and so on, there will be students whose personal beliefs, values, and senses of self are challenged. This is standard fare in almost every philosophy class, and it frequently spills over into the hallways and down the hall into the philosopher's office, where philosophers engage informally in philosophical counseling on a daily basis. Students want to know, are my beliefs rationally defensible? What should I believe? What do you believe about this, professor? There we see the philosopher placed in the role of guru, but the philosopher rarely reveals what they personally believe, and more typically notes that their personal beliefs are not relevant to the assessment of the topic at issue, since philosophy is more about helping students figure out how to think than what to think. Professor, what should I major in? My parents want me to do X, but I like Y. What should I do? Philosopher as life coach. Professor, I'm spiritually inclined, but I don't trust my family religion anymore. The majority of things I read on these subjects. Can you direct me to some reading or some philosophy that might help me find some real wisdom? Philosopher as philosophical counselor. Again, philosophers command an anekantavada, the non-one-sidedness like view, array of conceptual tools to address such concerns, and typically a wealth of experience addressing them in the classroom, the hallway, office hours, with countless students, but also with certain colleagues, friends, relatives, and anyone else who seeks a philosopher's typically insightful, broad, relatively objective perspective. Anyone who wants to speak with Socrates, so to speak. Socratic midwifery addresses issues in every category and on every level. For example, the first order level at which any issue is raised, but also a variety of meta-level analyses of the epistemic, metaphysical, and axiological assumptions framing that first order issue. Its tacit conceptual framework or paradigm assumed, its logical implications, its counterfactual or hypothetical alternatives, its truth or falsity conditions, its consistency with the client's other beliefs and values, and so on. By contrast, psychological counseling often operates at the first order level at which an issue is raised, although it often also addresses other dimensions of the issue, such as its genesis, manifestations in behavior, responsiveness to a variety of interventions, and so on, depending on the type of psychology in which the practitioner is trained. For example, psychoanalysis, Gestalt, CBT, cognitive behavioral therapy, etc. CBT is derived from Stoicism and its rational interrogation of beliefs, judgments, intentions, and actions. CBT is essentially philosophical counseling in psychotherapeutic drag, as are a few other psychotherapeutic modalities derived from Stoicism, such as logotherapy. Mindfulness is now being added as a component of almost every other form of psychotherapy, and may similarly be described as secular Buddhism in psychotherapeutic drag. These emerging modalities are empirically superior to most of the alternatives that lack them, but they derive from philosophies practiced as ways of life, Stoicism and Buddhism. Philosophy is a sapiential practice, a kind of meta-wisdom tradition that includes multiply layered examination of all the world's wisdom traditions, as well as all domains of knowledge, reflecting the etymology of its name, love of wisdom, the two components of which have all but disappeared from purely academic philosophy, as opposed to the sorts of philosophers for whom philosophy is a way of life, a contemplative path that the ancient philosophers embraced in both ancient Greco-Roman and Indo-Asian philosophical traditions, but which philosophical counselors embrace today. Unlike philosophical counselors, psychologists do not follow a psychotherapeutic way of life outside their sessions, nor do their clients. I'm making generalizations, but they're generally true. Psychotherapists also tend to listen more and advise less, whereas philosophical counselors encourage equal dialogue. Similarly, psychotherapists generally take non-judgmental relativistic roles, whereas philosophers actively challenge their clients' beliefs and actions. Psychotherapists generally support whatever the client's undergoing, whereas philosophical counselors interrogate those supports to see if they're problematic or inconsistent with the client's other stated commitments. Philosophical counselors don't generally act like they have all the answers, despite offering many possible answers, whereas psychologists generally do act like they have the answers, though they rarely offer any explicitly. Socratic wisdom may be described as an awareness of the limits of one's knowledge, which constrains the confidence of philosophers inclined to maintain towards any beliefs, including their own. As anyone who's ever gone to a psychotherapist for an issue like family counseling, midlife crisis, divorce, or change of career type counseling knows, insurance procedures covering psychotherapy incentivize psychologists to creatively diagnose, to put it charitably, in order to be paid for their services. For example, to select a diagnosis such as anxiety because the above listed problems might not be covered by insurance, but might be associated with some anxiety. Just as philosophical counselors are likely to lose clients by virtue of their intellectual honesty in challenging their clients' rationalizations, so too philosophical counselors would not likely re-describe their assessments in order to receive insurance fees. The sorts of philosophers who go in for philosophical counseling see wisdom as the core virtue informing all other virtues, all of which they devote their lives to cultivating in themselves and anyone else they might be able to influence. Most philosophical counselors have had clients that are psychologists, and a number of philosophical counselors are licensed psychologists. The fact that the different types of practitioners seek each other's expertise says more than any arguments against the one or the other type, and perhaps speaks volumes about gurus who never seek non-guru advice. Each has a domain of expertise and ought not to be viewed as in competition any more than cardiologists are in competition with general practitioners. In the same way one's doctors will refer one to other specialists, many psychiatrists and psychologists will refer their patients to philosophical counselors and vice versa. Gurus, by contrast, attract people who want concrete direction from someone with confidence in their own wisdom. Excuse me. The gurus have a facade to keep up, but unless they're actually enlightened, many of them would probably benefit from philosophical counseling like anyone else. As a practitioner of meditation and yoga since 1973, I've had a number of gurus, and I've tried to engage in philosophical dialogue with some of them. But for some of them, their commitments to the appearance of their own authority constrain the extent to which such an exchange can be open. The followers of gurus, however, can benefit greatly from dialogue with a philosophical counselor. with whom they can more openly explore their doubts about the guru and the guru's teachings. A philosophical counselor is a genuine source of meaning, guidance, wisdom, value, and virtue, as are true gurus, but is not one to dictate what to do, think, feel, or believe, nor one to demand piety, loyalty, devotion, faith, surrender, unlike most gurus. The philosophical counselor's main job is to help the client awaken the inner philosopher, to help them find out what kind of philosopher they are, to help them develop their own philosophy. By contrast, the guru imparts the guru's philosophy, and the disciple is expected to embody it. Thus, the philosophical counselor is a blend of guru and anti-guru. Finally, in practical terms, if anyone is struggling with any of the overlapping issues for which people seek the assistance of a psychologist, life coach, or guru, they will be well served to contact a philosophical counselor. The American Philosophical Practitioners Association, APPA, has an online platform, APPA Chat, in which philosophical counselors from the world over are available 24/7 and may be enlisted immediately. Thank you.
Thank you, Dr. Repetti. Thank you. Any questions? Please raise your hand. You have a chance to raise your hand and be called on, or you can put your questions in the chat. Any questions?
Yes, ma'am, there's one. Yes, Rajan.
Yeah, thank you, Professor. It was really enlightening. I also worked on the Stoicism, so it was really intriguing for me. So my question is basically this, like what would be the basic motivation, fundamental motivation of philosophical counselor? Will it be money? Will it be fame? Or will it be love of wisdom? So if we consider that it will be love of wisdom, then I am quite skeptical. In the modern time, we all are somehow quite like sophist. So if we are quite like sophist or materialist, then there would be a chaos into the society. People would be misguided because philosophical counselor would be working in the name of money, in the name of fame, and so on. So at that time, how would you distinguish philosophical counseling from self-help gurus and so on? So this is the fundamental question I want to ask.
Thank you, Rajan. That's a really good question. And, you know, I have a lot of friends being in the world of meditation and yoga for, you know, multiple decades who teach yoga and meditation. And in this community, you know, my first spiritual teachers, meditation and yoga teachers, they didn't charge any money, and they convinced us early on in my life that charging money for this kind of thing was improper. It was a mistake. It was an automatic sign that you were not a pure channel for, you know, the divinity that should come through, like a guru type and everything. But we live in an economic world in which, you know, we are not living in a world where we all have a universal basic income, right? If you live in a place where nobody charges anything and everybody shares, like, you know, maybe in some remote villages in India, it's still that way, where the barber cuts everybody's hair and the farmer feeds everybody. But in the rest of the world, we live in a system of economic exchange, so we have to charge money. But, you know, many philosophical counselors, if not most of them, don't make enough money doing, they don't make enough money doing this for it to be about the money. Now, they should be paid for their time, but many of them do it for free. Many of them do it for a fraction of what they get paid teaching in the university, their hourly rate as professors. Right, so I do think that the motivation that attracts philosophical counselors into philosophical counseling is more the love of philosophy and the fact that it's an opportunity to share philosophy with people who come to you not just for credit in a college course, but because they want some philosophical wisdom. So the ability to share that with other people, I think, is the primary motive. There are some philosophical counselors that's all that they do, right? But even then, I think most of them are flexible with their fees, will do pro bono work, will do it for nothing because they love this kind of work. So I resist the idea that everybody is, what did you say? We're all more like sophists? I disagree. I think that philosophical counselors are the least like sophists. Compared to other philosophers. But philosophers in general are people with the kinds of brains and skills who could make 10 times more money in the marketplace if they went into informational technology, coding, almost any other kind of field. Yeah, or psychology even, you know, but they're attracted to philosophy because they love philosophy. So I kind of said, unlike the previous Regina, no, not Regina, Lydia, who said, oh, you know, there's a continuum between philosophy in the academy and philosophical counseling. Yes, there is. I put a contrast in it because I was comparing, you know, to try to highlight what I think is distinctive of philosophical counselors. Not everybody in the academy is a philosophical counselor. Philosophical counselors are a subset of philosophers, nowadays anyway. In the ancient world, maybe it was different. But this has been an issue throughout the history of philosophy. I mean, even in India, throughout the history, you know, all the early great philosophers were arguing with other philosophers for, you know, the benefactors who would support them if they won the debate, right? So is this sophistry? It depends on the individual. I prefer not to make that kind of generalization, but I hope I've answered your question. I'm not sure, Rajan. Is that good enough for you?
Yeah, thank you, sir. Thank you so much.
Okay.
Yes, Kanchan.
Yeah, hello. I have a question that what about having philosophical counselors in even professional setups like hospitals? There is grief counseling or bereavement counseling. So even we doctors are not enough sometimes to explain that, or even in schools we have counselors, but what about having philosophers, philosophical counselors there as well? Because we can see at least in India, student suicides are on the rise, or even in offices, in corporate setups. Whenever they have been given the pink slip, in India there is no counseling. Just in the morning, person comes and he is told that anymore you won't be working. And I think more than psychiatrist or psychologist, philosophical counselor can play a greater role. So what is your opinion on this?
Oh, I agree with you, Kanchan, 100%. It's starting to happen that you'll see even in various corporate settings, they'll have a philosopher on staff. I worked in a company years ago when I was still a student. I had a copy editing job in a major consulting firm on Madison Avenue in Manhattan, which was, you know, they had elite clients like JP Morgan Chase Bank and whatnot. And they would, you know, they were consultant companies. So they would go in and look at a client's company and try to figure out ways in which they could improve their practice as a company. They had a philosopher on staff, right? And this was back in the 1990s. It's happening more frequently. It's happening increasingly, I think significantly thanks to the efforts of all philosophers, not just philosophical counselors, but there's a movement for public philosophy, for bringing philosophy to the people. And it's spreading throughout the world. It's in the earliest stages right now, but it's happening. And I think it's a wonderful thing. I think you're absolutely right. It's important. We need philosophers in almost every domain. That's my personal view. I'm all about bringing philosophy everywhere, into the marketplace, you name it. I participated in this only once so far. I call it philosophy to the people, but there's a public philosophy network in the United States, and we set up these booths outside in public places, like in a subway station or in a flea market, where we'll have a table with a big sign, "Ask a philosopher." And we just sit there and people come over and ask philosophical questions, and we engage in philosophical conversations. People are interested. People are interested. People want to talk to philosophers, especially nowadays. Somebody, I forget who, earlier, whether it was Regina or Lydia, mentioned COVID. During COVID, everybody has philosophical questions right now. Who should I believe? What's the real science? What matters? I'm isolated from everybody else, so I have more time. I'm in more solitude. I have to think about my life. What if I die? People close to me are dying. I never expected that I might die at an early age, right? All of these are philosophical questions. It's important. I agree with you 100%. I hope I've answered your question, but let me know if you have a follow-up.
Thank you.
Thank you. Good answer. Chanatu? Oh,
Yeah, it's Charutra.
thank you.
Yes. I hope I'm audible.
Yes.
Yes, dear.
Okay. So the talk was really wonderful, and I, came up with something which I wanted to know for a long time. If any person who is following any particular spiritual practice, or who is very convinced by some teachings of his or her own guru, who may find it very rational, very valid, and very philosophically presentable, then can such a person be a counselor? I mean, if he or she is convinced with his or her own ways of looking at life, or of discovering the self, then can such a person be a counselor who, yeah.
That's a very good question. So here's what I say. In the tradition of your country, the guru disciple tradition, you reach a certain level of attainment and then you share your wisdom with everybody else. This is a natural, spontaneous thing that happens in a community. Somebody might just be an unknown housewife somewhere who has some kind of experience with or without the guru being physically alive, and becomes a kind of sage, and then everybody flocks to that woman, for guidance. They don't need the title philosophical counselor, right? This is just part of a different way of philosophical practice. But if you want to use the title philosophical counselor, I think you need to be somebody who's familiar not only with this one philosophy that your guru has, right? Which is unless you happen to have a guru who's like Aurobindo or somebody who has, this kind of multiple perspective about everything. A lot of the guru, lineages have this one vision, one darshan, and that's it. So you need, philosophical counselors should be more like the Jain perspective of Anekantavada. They should have a multiple understanding of different philosophical systems to do philosophical counseling. But it's not that the guru or the individual who has only one philosophy is not doing philosophical counseling. They are. They're doing it within a narrow framework. That's the only difference, according to maybe one paradigm. That's my answer. I don't know if this is helpful.
Thank you, Doctor. We're going to have to move on to the next speaker. Thank you, Dr. Repetti. Very
May
interesting.
I ask one question,
And I'm
sir?
glad you did bring up the issue of psychotherapy. And
May I ask one question to doctor?
hello. We're going to
Hello?
move on to another therapy. If you have questions, put
Yeah,
them in.
one question, a very simple one, just came to my mind.
Okay.
Thank you, doctor, for your very, very clear presentation and how the psychological psychotherapy and philosophical counseling overlaps, and that's create a lot of confusion among the participants here also. But my question is very simple one: what a philosophical counselor will advise in case of a moral dilemma? The instance which is in my mind is, you must be knowing about a student of Sartre coming to Jaspers Sartre for his advice whether to go for military service and fight the war for the country, or to serve his ailing mother. And Sartre says, you will have to choose. So how will you respond to this situation? Thank you.
I'll be very brief because Regina wants us to move on. Like Sartre, I would try and encourage the person that they certainly have to be the one to figure out the answer. Unlike, somebody else who's going to tell you what you should do. Philosophical counselor's job is to help that student weigh the pros and cons and find out what's their real value structure, what matters to them more, where is their heart in the issue. And by playing around with their beliefs, their behavior, and everything else to help them perhaps maybe come up with thought experiments or other things that just trigger the process that the student is stuck right? They have both values, but they have to figure out which one matters more. And only the student can do that. There's no automatic answer in philosophical counseling. What should the student do, right? It's more about the philosophical counselor should be able to bring a variety of cognitive tools and tricks to get that student to kind of break through the impasse and find his or her own way. That's all I would say about that. Regina, please, sorry.
Yes, very good. I agree. I think that it does provide a foundation for how to reflect on difficulties overall, too, in general. The next speaker, we have Dr. Shanti Jones. She is the last speaker, but not the least, given her experience and credentials. She is a certified philosophical counselor and independent scholar. And it's been mentioned in both of the prior speakers that bringing to the public and introducing philosophy in the agora. And here is one lady who is doing that on a very original way. She lives in Tufts, New Mexico, USA, and that is a place that's deemed very spiritual by the Taos Native Americans. She has been a member of the APPA for several years and has written several articles related to philosophical counseling published in the APPA journal. Her topics often center around how literature and plays can help towards philosophical and spiritual well-being. She is a member of the Institute of Transpersonal Psychology and also practices transpersonal psychology. She is a teacher of character development and emotional intelligence in public schools. But most noteworthy and interesting is that she has pioneered an original art form of public performances of philosophy, and she calls this philo cabaret. If you know what a cabaret is, it's an entertainment mode. She writes, produces in these performances, as well as sings. And if we have a few minutes, maybe she'll provide that, her philosophical tributes. Her latest work is titled, What's It All About? And on the meaning of life. Today's topic is building a bridge between the worlds of counseling and philosophy. Lessons from the world of Karl's Jaspers. Dr. Jones.
So I would like to share the screen now. So I'm going to bring this over. Let's see. This is what I was afraid of. It doesn't want to share the screen. Let's see. No, somehow it doesn't want to share the screen. So I'm going to send this by email, I guess, to and then someone could put it on the screen there, please.
Just a minute, Shanti. Madhulika, you have to make Shanti co-host so that she can present the screen.
She's already
Yeah, when I drag and drop it, it just doesn't do it. And I've had this problem before.
Oh, you don't drag and you don't need to drag. What you can do is just open your, put on share screen.
I did.
Okay, and then go and click on it and it'll open up.
Okay.
Yes, ma'am, it's working.
Just a minute.
So just click on what it is that you want to share and it should pop up.
Just a minute. Okay, did that work? Can you see it?
No. Did you click on it?
Yeah, I can see it.
Ma'am, it's loading. It's loading.
Oh, okay.
Can you see it yet? No?
You haven't selected the file, I believe, Shanti. You have to choose the file that you want to upload.
I clicked on it and I can see it, but you can't see it. That's the problem. So I'm just.
Rick is trying to say something. Rick, are you talking to us? You are on.
Go ahead and send it by email.
Yeah,
That's
please.
what I'm going to do, is send it by email right now.
Okay, thanks.
Madhulika, can you give her your email address?
Yes, yes, sir, we have already, ma'am, we have dropped the mail ID in the chat.
Okay.
I think there's some connectivity issue. That is why.
Okay, so I'm going to email you at the PCC 2002 conference.
Yes, ma'am.
Okay. Okay, I'm not going to put a subject. I'll just send it to you right now. Okay.
You can stop sharing and then the conference will pull it up. So here we go.
Thank you. Then I'll just have to ask you to change the slides for me, please. Next slide, please. Can you change the slide? There we go. So what I'm very interested in is, I have been in private practice all my adult life. So this is my laboratory, and I'm very interested in how different philosophers can really influence the thinking of a case. So one of my favorite philosophers for philosophical counseling is Karl Jaspers. And he was a German philosopher. He was first a psychiatrist and trained at the same time as people like Freud and Jung, and at the same hospital. So he worked as a psychiatrist until he was about 28, and then he went into the field of philosophy and was a teacher. But the reason that his work is so valuable to philosophical counselors is because he did start out as a psychiatrist and was always interested in the psychology of human beings and how that related to philosophy. He has a very well-known book, and I have a list of his books at the end of the presentation, called Psychopathology. It's in 2 volumes, and I really recommend it as a good textbook for philosophical counselors. It's the first book in psychopathology that it was written. So I'm going to show you some of Karl Jaspers' philosophy, and then I'm going to show you how I applied his thinking into a case. Next slide, please. So here's a quote from Karl Jaspers that the value of existential analysis. And this is where I started with in the thinking of this case. So one of the things that it can do is it can liberate human existence from beguilements or debasements, which it's subject to. And this client that I'm going to present is a 13-year-old girl who's cutting herself. And that's certainly a debasement. And what's the work that I do with her over 9 months and 18 sessions is to direct her existence towards an authentic one that's well grounded in herself and with the people around her and the world that she's in, and also in relationship to her spirituality. So here's how a philosophy of, is started and a case is built upon that. Next slide, please. So this is, I'm going to show you how philosophy helped a troubled 13-year-old, like I said, who was cutting herself. And she had no idea why she was doing it. Her parents had no idea. And of course, when she came to me, I didn't have any idea. And normally, I'm showing this case too, because normally something like cutting oneself wouldn't be considered a domain for philosophical counselors. But her parents weren't interested in traditional psychotherapeutic approach. And this young woman was certainly not someone who was looking like she was suicidal or off the deep end. So I felt that it was worth working with a philosophical perspective. Next slide, please. So I'm going to use 4 concepts from Karl Jaspers that you might be familiar with that provide a positive feedback loop when you think about them throughout a case. And the first one we'll talk about is limit situations, meaningful connections, uses of symbols as ciphers of transcendence, and also freedom. Next slide, please. So what are limit situations? They're really when you're at the edge, right? When you're suffering, you're struggling with something like death, chance, guilt. Maybe you did something that you really shouldn't have, and you feel so guilty you almost want to kill yourself. So what happens in those situations, like my client who was cutting herself, they can't really understand what is really fully happening because they've never really experienced this situation before. So they're at the limit of their understanding. And there's nothing firm or stable or absolute to rely on, no prior experience. And sometimes it even brings up questions of God. Is there really a God if he allowed this kind of thing to happen? And the person's vision doesn't extend far enough to help them to know what to do. So this is why, again, talking about philosophers being able to go from the practical to the concrete, to the theory, back to the practical. So we are going to use some of the theory to help her push past her limit situation. Next slide, please. So meaningful connections. Karl Jaspers was a phenomenologist. So he used the process of phenomenological reduction when he saw his work with his clients. So with the phenomenological reduction, you enter into the client's world with its particular and multifaceted intentions, as well as their beliefs and involvements. You try to understand what the client values, how one event emerges from another, and the ways they are linked together. And you recognize the client's identity beyond its surface appearance. And you do this, that's okay, next. You do this through several ways: the content the client discloses, observation of the client's mannerisms and behaviors, your own self-reflection, and the use of symbols, which we'll talk about. Next slide, please. So symbols, a lot of philosophers don't really think about using symbols, but Jaspers was really talked about them as ciphers of transcendence. They build a bridge between the self and the world. And also because you are expanding your world, you are, and you have to think about that, it offers access to a philosophical awareness of being, helps the client to understand what they're meaningfully connected to. It can illuminate their worldview, help in overcoming subject-object duality, because in some way, when you identify with a symbol, that symbol is something inside of yourself that you're connecting with, and in that connection, you and that object become one. help in knowing the truth of one's existence and to live from that place, and includes the non-rational in the domain of human existence. Next slide, please. So here's an example of a symbol, right? We all know this. We look at this statue and immediately, we would think beyond that, that it's not just this gold statue, but it represents things like inner peace, wisdom, the sublime, deep understanding, compassion, so that when you look at that statue, it opens up a world of transcending into those states that you wouldn't have if you didn't have that symbol in front of you. Next slide, please. So I use something called Sandplay, and Sandplay came out of Carl Jung's thinking, and he was also a big person of knowledge of symbols. And I have a collection. I like it because it has everything in the world in it in miniature, and then there's a box. So whatever the client picks from the collection is meaningful, and through dialogue and meaningful connections are found. And it also, in a very graphic way, it reveals the client's worldview. But if you didn't have the Sandplay collection, I have clients bring in objects from home that represent things like wisdom or love or friendship. And by having those objects that are tactile to them, they can also, open up worlds that they might not necessarily talk about, even works of music, pieces of art, their own artwork. So here's her first sand tray, and to you, it just might look like a bunch of toys, but to the experienced eye, you begin to make separations of what did she choose and why. So you'll see here in this corner down here, there's a lot of Walt Disney figures, and she described that as her family. So you can see that really, even at 13, her family they weren't real people to her yet. And she didn't feel like she was a real person. They were like cartoons in a cartoon graveyard. So I began to think, well, how am I going to help this person to relate to people as real in this world? And next slide, please. So here's the cartoon people, her family. Next slide. So this is her grandmother's house, a place she felt safe. So you can see there's, dogs, and there's peaceful, it's good. Next slide. And there's a church here. So she has some kind of nascent, spiritual life. She was Catholic. So we never, in our 18 sessions together, went in deeply into her own spiritual beliefs, but they're there for later development because she's obviously connected to them. Next slide, please. So this is at her house, and you can see that the house isn't quite so nice, and in front too, there's these snails, and that's she and her sister, she said. And, so how would you feel if you lived in your own family and you were like a snail and you felt like you could be stepped on at any moment and just crushed? So that led me to see that, she was very vulnerable in her family and not felt protected enough really to have a structure of a self, to rely upon. Next slide. So one other thing that before we move off of that set of slides, if you'll just reflect back that there was nothing in the center. And if there's nothing in the center, like just think of your own being. If you don't have anything in the center, you don't have a self. So I realized that she didn't have a self developed yet. That was like I was showing you the snail. And then also in one corner of the tray, there's a sheep that's surveying everything. And so really that's her position in life at that point, like a sheep. she's gone astray. She doesn't have a self, and that's what she needs. And this is where the freedom comes in, to become the subject of her life, to be free to make choices for her own being. Next slide, please. So how does a person become free? So Karl Jaspers says that freedom arises when the superficiality of chance is pitted against the arbitrary volition of the moment. So the superficiality of chance is that she's living in a family that constricts her, that controls so much of what she does. In fact, the father was thinking about taking all the doors off the house so that the daughter couldn't have any time alone, so that if she wasn't alone, she couldn't cut herself. So trying to control ultimately everything. So that's the superficiality of chance. She was born into that family. What was she choosing to do about it? She was choosing to cut herself. That was what she was choosing. So that was for her a free action. But what we needed to do was to make it conscious, to see, was that really the action that would get her the best possible results for her life? So it's a process, he says, of realizing I really am, I must do something, and I will, and I'll choose to do something. And allowing all the motives that she has to speak within herself, to broaden your world orientation. And then, of course, just like any decision-making process, visualizing and enacting other possibilities of action besides, in this case, cutting herself. Next slide, please. So we help the client to become free, and this has been mentioned several times by Lydia and also Rick, that how do we do this? It's basic problems that you try to see what are all the possibilities that would arise from the client's authentic self, and how do they make the independent choices arising from what is meaningful to them. And then also, as I'm teaching her, this ultimate situation she's in now, she'll be in others in the future. So rather than running from them and finding a regressed way to handle it, what are ways that you can expand your understanding and learn from it? Next slide, please. So you do this process of helping the client to become free through dialogue, reflective thinking, decision-making skills. I also use dream analysis. And in this case, I did some parental coaching because when I saw from the Sandtrays and the client's interest, like that she loved to draw, and she could draw 2.5 hours a day if she had alone time. So I got her parents to actually give her her own room, separate from her sisters, where she could have time to work on a lot of her creative projects. And honestly, once she started working with me, she only cut herself once more. She started working with me in September, and I think she cut herself once more in early December. And then she never cut herself again. And I think it's because all these other tools were much more exciting and pleasurable, and had a much more of a purpose than continuing to cut herself. I also did teach her about, and her parents, we did some awareness of her own sexuality. And I think anyone would agree that pleasuring oneself is more oneself. And I think that was another aspect too, was helping her to become the subject of her sexuality. Next slide, please. So in the beginning of our work together, her father and mother had decided that that her interest should be volleyball and basketball. And they were even going to send her to a volleyball camp. And in the process of doing her Sandtrays, she put in this runner, and really what her interests were in track and cheerleading, and so we were able to get her parents to, she was able to verbalize to her parents that those were her interests. She started putting her time into the track team, and also then into the cheerleading team, which gave her a group to belong to, people that she could identify with and not be afraid of, so that she could have meaningful connections with others. And also the entering into something like track, she wanted to shave time off her running. And so we worked through a lot of problem solving skills, how to do that, like, being able to strengthen her feet, push off from the starting block, lifting her heel up a little bit further with her toe bend. I taught her how to think through problems. She could list about 15 different ways that she could improve it, shave seconds off all on her own, off of her running time. So I used the running to help her develop more cognitive skills and problem solving skills. So now she's doing something that she wants to do, as opposed to something that her parents have told her that she should be doing. Next slide, please. Yeah, so here's the cheerleader, and she joined the cheerleading team, and their team won the state championship that year. So that gave her a really great feeling too. Next slide, please. The highest good, that's one thing we talk about ethics. For me, that's the point of working with my clients, is achieving the highest good for their life. And so we did this through establishing connections that were meaningful to her. She learned how to think rationally, to evaluate her own judgments, how her desires could be directed towards her own good rather than her destruction. She created a world that was more satisfying to her, and she gained her freedom, a sense of herself as an independent person with agency. Next slide, please. I think the next slide is the books I want to show you. Yeah. So here are the books that I utilize of Karl Jaspers that have been the most helpful to me in my work as a philosophical counselor, and they're generally available. And I'm going to write an article before very long on Karl Jaspers and his thinking and his general psychopathology to make his thinking more available, because I don't know, I'll be interested to hear from you. I think a lot of times in school, they don't even teach Karl Jaspers. Many philosophers I know are really not aware of his work, and yet it's so directly relevant to us as philosophical counselors. So I think that's all I have to say. Yeah, okay. I'll take questions.
Thank you. Questions? And we can stop the sharing.
Mm-hmm.
Can we stop the sharing? And I think Dr. Repetti has a question.
Yes, hi Shanti, can you hear me?
I can hear you, Rick.
Great, excellent presentation. I'm curious, it takes a lot of courage to take on a client who comes to you self-cutting. I would probably be insecure to do that. So I'm just curious how or why or what made you feel safe as a person with this great responsibility? I'm curious. I know you have a background in psychology. Maybe that's the difference. I'm just
I don't
curious.
know, So one of the things is, Rick, that my philosophical counselor is a board certified psychiatrist. And I not only consult him for my philosophical counseling work, because I see him regularly for that, but when I have clients that I have questions about, I use him as my consultant because he's multiply trained. So when this case came to me, I talked with him about it, and we had backup plans, and and I did offer. So I was covered too, because I did offer to the parents, well, here are a few psychiatrists in the area that specialize in cutting, and they didn't want to do that. So they agreed that they wanted to try this. And I made right away, I made a treatment plan. So I gave them a very specific treatment plan of what I was going to do. and a booklet actually that they could read. And they, so we had concrete things that we were going to do, and they agreed. And yeah, and then when she did cut herself the one time, I kind of panicked, and then, David suggested I call her and ask her if she was all right, and if she would, felt that she was in any danger. And she said no, she was all right. She was just under a little pressure. And so we had a normal human contact about it, and then we went on. And like I said, then she never cut herself again. So I just kept figuring I was in the right direction, and she just kept getting happier, and everything kept going well. Thank goodness. Geez. Yeah, I did take a risk, but I did have backup, and I think that that's something to have good backup.
Very impressive, Shanti. Thank you.
Thank you.
Thank you. There's 3 others. There's, I think Dr. Amir is one. There's Miss Tandon, and then Andre, in that order. Go ahead, Dr. Amir.
You're muted, Lydia.
You're muted, Lydia.
Still muted.
You have to go down to your left corner, Lydia.
I'll go ahead and go to Alok Tandon. Go ahead, and then Dr. Lydia can figure out how she can unmute herself. Alok Tandon, you have your hand up.
Yeah. My question is simply that what is your idea of authentic self to which you lead your clients to realize, and then treat them in that manner? Because I think this whole idea of authentic self in philosophical counseling needs to be clarified. Thank you.
I would agree. I would agree. You're asking me, that what is the person's authentic self? And there's so many, that's an ongoing process, isn't it? Till we die, finding our authentic self. Yeah. So I think that really should write a paper on that. I don't know. Does anyone else want to offer any ideas right now? I wouldn't really want to, it seems like it's a whole book in and of itself, really. Would anyone else like to venture? Help me out?
Well, from a Platonic view, you can find possibly the description of the authentic self in the Parmenides, or in Proclus's commentary on Parmenides, and also in terms of Damasius. That's one avenue if you wanted to go down that way. And what's interesting about that direction is it was pointed out to us that in the Greek, autos, which is an adjective, is often translated as he, she, or it. But if you look at the first translation, it's self. And if you put an article in front of it, it elevates it to a substantive that is the self. So they were playing some very interesting, playing with some very interesting ideas. So I would go there as a possibility.
Thank you. I'm thinking too, that as just on a practical level, how do I help clients know what's authentic for them? I tell them to do 2 things: the Buddhist meditation of this is me, this is me, this is not me. So you look at everything in the world, right? There's only certain things that you're going to identify with, and there's a process of discrimination throughout one's whole life. So I have my clients do this if they're not sure and they haven't identified, they go around in the world and go, well, Is that behavior, is that me? Is that dress me? Is that person playing a piano? Can I imagine me doing it? So yes, no, yes, no. So it's this kind of lifelong discrimination. And then the other thing is to notice when your energy goes up, because if something makes your energy go up, it's generally because you're identified with it in some way, and it's life-giving to you. And if your energy goes down, it's because it's not life-giving to you. And so those are two very pragmatic ways on a day-to-day level for understanding, getting closer to what's really your authentic response.
Oh, it's a good answer. And maybe their best states of mind. Yes, now you are up, Lydia.
Yes, thank you very much. And thank you for this comment, Shanti, because I would like to react on that. But before, about what Ricky said, let me continue that sometimes we don't have a choice. I found myself dealing with a client that was also cutting herself because the mother was a yoga teacher and didn't want a child of 18 to go to a psychologist, to a psychiatrist, and was looking for alternative ways, if you want, to address the issue. So I did my best to send us to a psychologist, but it didn't help me. So I had somehow to deal with that. Sometimes we are the last address, the last place, and when we send people too easily away, we are not sometimes aware that they won't go anywhere. So we may be, we have to take responsibility for that too. And your talk was inspiring in that sense as well, because you said at the beginning that the parents didn't want to follow other ways. But about what you said now, authenticity, I think COVID showed us, and the social media, that people tend to feel comfortable with ideas and views that are similar to their own, but this is not how we grow. We grow, especially when we talk about philosophy, but by opposing points of view, by being outside of our comfort zones, and in a way outside of the authenticity ideal, insofar as it's not the core of the human condition, but a very personal, individualized self that we're talking about. So just to challenge the idea, of course, I will feel comfortable with people we know from psychology who are most like me. You know, I don't have to use my feelings and thoughts to address what we call the difference, sometimes handicapped, and especially not differing points of view or facts that may challenge the way I think. So here's a question: shouldn't that be also our job, philosophical counselors, to get a person outside of the comfort zones and not to find what talks to her, speaks to her, but to the contrary, to be challenged by what is completely different to her?
You're asking me, Lydia?
Yes.
Yes. Yeah, no, I think if I agree with you to get out of the comfort zone. And so, for example, I did that with this client by, she was not comfortable talking with people. So I used some rational emotive techniques. Why are you not comfortable talking with people? They're going to judge me. They're not going to understand me. They're not going to be interested. So, what are other things that you could tell yourself other than that? So then she practiced outside of her comfort zone, going to talk to people, and using her new thought processes. And she did find soon that she was more comfortable in groups, which was allowed her to get into the cheerleading group. So yes, I agree with you. They have to get outside of their comfort zone. And what we would say in some ways really was the cutting was her comfort zone at the time when she started, right? That's the only thing she felt comfortable doing. And and all the rest of it was sort of alien. Choosing what was right for her was uncomfortable. Yeah.
Thank you so much.
Thank you. The next one is Andre, and then Charuta and Bhumika. Go ahead, Andre.
Thank you, Regina. So I will come back to your talk, Shanti, but just like Lydia, Rick's comment made me think, I think that's a very interesting issue, actually, because I think, yes, if you accept the client in those conditions, in those circumstances, you are taking on a responsibility. But I think there is also a responsibility involved in refusing to take on the client. I don't mean to say that people should or should not take on this kind of clients, but it's a choice. And like any other choice, we are responsible for the choices that we make and the consequences of those choices. So it's a little bit tricky, that issue. It's a very interesting point that you raised, Ricky. As to you, Shanti, thank you. I think it's the 4th or 5th presentation from you that I have seen. It's always a very lovely, pleasant experience. I have just a curiosity. It's a simple one, I think, but in the approach that you took with this client of yours, the symbolic element was relevant, right? And since that is the case, I will assume that when she was cutting herself, she was communicating something as she was with the very act of cutting herself. And I wonder if I don't know if you agree with that, but if you do, I wonder if you have any thoughts about what it is that she was communicating exactly when she was cutting herself.
Right. Well, I think one thing, was one thing that she could do outside of her parents' approval, that she had control over, right? She could find ways to do that. So it was one of the few outlets, independent outlets, that I think she had something. Oh, I'm doing this, and then there's a lot of reasons, if you look at books on cutting, why people choose to do it. And like one of the things is that they can see their blood, so they know they're really alive, because they can't feel that they are really alive. So they see it and they go, oh yeah, I'm really alive. And sometimes it's just to feel something, right? They've been cut off from their feelings. So that's why I went with if I can help her to feel alive in other ways, feel excitement about other things that expand her world, and that I can get her parents to approve of, right? Which we did, of course, find those things, and her friends. Then that would be more, like I said, she would find more aliveness and interest in that than in the cutting. So that's where I tried to go. I think that was the original. Those were the only tools she had. So I gave her as many others that she could use, and that seemed to be more satisfying to her in the end.
Thank you. I just got notice that we are coming to the end of our time. If you have any questions, please put them in the chat and they'll pass them on to the respective speakers. I think this has been very eye-opening, and I want to thank each of you for myself, as well as for Professor Bala and the conference. I think he can end with his own commentary, but I think that it's been eye-opening, and I hope that we all have benefited by seeing that philosophy and philosophical counseling is a viable way to come to work together and work with ourselves in a meaningful way. I want to thank Dr. Amir, Dr. Jones, and Dr. Repetti, and myself. And so thank you very much. It's the first time for me, but I'll pass it on to Dr. Bala.
Yeah, thank you so much, Regina, for that wonderful compilation of chairing the session and moderating everything so well. It's what a wonderful way to end the first day of the international conference. Wonderful presentations by Lydia Amir and Rick Repetti and Shanti Jones. I was just trying to understand, trying to construct a kind of a debate between what Lydia has said and Rick has said. Okay, I may be wrong, so please pardon me for that. Both of you, Lydia and Amir. Lydia has begun saying that good philosopher has to be a practitioner as well, right? So unless you're a practitioner, you will not be a good philosopher. So it's totally ingrained in being a philosopher that you should be practicing. And Rick says, interestingly, that if you're a philosopher, then you cannot be a practitioner in the real sense, because by being a philosopher, you would be limiting or committing yourself to a particular perspective. So once being a philosopher, you are committed to a particular perspective, then you would be narrowing your focus. So if that is the case, how would you both respond to this interesting diverging perspectives that both of you have come out with? So this is an open thing that I thought I should place it before the audience. With regard to the response that Shanti has given to Alok Tandon's question with regard to the authentic self. Now, how do we reach that? And most important thing, probably what he was hinting at is also like, is there anything, an abstract kind of one that everybody has to reach out to, like an ideal, which is not possible? Or how do we construct? That's where I thought the co-creative enterprise, philosophical counseling itself as a co-creative enterprise, which pushes both of them to engage in a dialogue, through the dialogue constructing and trying to discover the authentic self. As I am always reminded of Lou Marinoff's example of dancing. He uses the metaphor of dancing for philosophical counseling. So you dance with the client so that both wavelengths would match, and then you reach out to a possible conclusion. So that's so wonderful listening to all of you, and so thankful to all of you for joining us, to make this conference this success. Thank you so much. And I can't thank Regina, because with a very short notice, she joined us, and early in the morning, she could get up and join us. We were worried whether she would get up and join us. That's great.
No, I was spending all night writing something out. And hopefully I'm looking at all the videos and things that each of these individual speakers did, because actually what they did in their bio did cover what a lot of what they had actually in their past provided. And so I thought, I'm going to add all this. So it's been an interesting journey. Thank you very much for allowing me, and also thank each one of you guys for, well,
yeah, please go.
No, just I was thinking of the ideal of self, and I think Dr. Jones mentioned, sorry, I don't, in formal presentations, I use the doctor, and so I don't use the first names. I think Dr. Jones mentioned, or was raised about authentic self, and it occurred to me that even in my own practice, there is something in the individual that hidden away in the many years of their experience, or in their even their turmoil, that they have something that they recognize that maybe at one point in their life that was authentic, and how to get to that, and then what it was that covered that up, or stopped it or blocked it or put it aside, because it's there. I've always found it to be there. So how you get there is an art form. But that was just a comment I thought I'd make to Dr. Jones, that I think there is something there all in everyone, that they have found it either in dancing or maybe just one memory of where they knew that they were real in themselves. If you could hold on to that and use that as a mode, as a anchor for them to see how their journey went away from that, it can be a way of staying with or bringing back that authentic self. That's all. Thank you.
Thank you so much, Professor Bala. Yes, sir. Are you saying something?
No. I'm just handing over the session to you.
Okay. All right. Yeah. I want to thank all our speakers, our chairperson, and Professor Bala. Thank you so much for this wonderful session. I'm very, very sure we have begun the journey of philosophical counseling in India at a very, very right note. Thank you so much. Just to let everyone know, so tomorrow we begin at 10 a.m. with Professor Peter Abe's keynote address. So please join us tomorrow at 10 a.m. Indian Standard Time. Thank you so much. Thank you all the participants and organizing team. Thank you so much.
I think everyone should put their hands up and thank you.
Yeah. All right. No. I want to thank everyone. Thank you.
Thank you.